All right. Well, hello, everyone, and greetings from Central Illinois. I'd like to start off by saying thank you to Professor Maitland for inviting me to join your class today. It is a pleasure to be a part of your discussions today about dementia. It is a topic that I am passionate about, and I'm going to tell you why that is today. I'll start off by formally introducing myself. I am Kathleen Wheeler, and this is my book. It's called Brought to Our Senses. In a nutshell, this is a book about Alzheimer's disease and how the disease affects family relationships, both in a negative and a positive way. Let's see. I want to start off first telling you, I guess the story of my book starts with my own story, so I'll start there. I'm going to tell you a little bit about myself, a little bit about the book, and then a few more details about the book. And don't worry, I'll try to be brief. And then I'm going to turn things back over to you for some questions. So the story of my book starts with me. I grew up in Central Illinois, and I was a kid who loved to read. This was me as a kid. I always had my nose buried in a book and read everything that I could get my hands on. So this love of reading turned into a love of writing as I got older. And I decided it might be nice to find a career where I had the chance to write for a living. So I went to the University of Illinois. I got a degree in communications. I moved to St. Louis. I started working for advertising agencies down there. A few years later, I moved back to Central Illinois to be closer to my family and also my husband's family. We all lived in this area, which is where I am right now in Central Illinois. And working for advertising agencies here as well, I was doing copywriting, writing things like print ads and TV commercials and brochures, that kind of thing. And, I really didn't have any ambitions to write a book at that point. I was writing as part of my job, and I thought that was great. And my career was moving along. Everything was fine. Then in 1996, my mother started showing some very serious behavioral issues and memory problems. Now, my parents divorced when I was quite young. My mother never remarried. She always lived alone. She was very independent. And so there was no one really around close to help her as she started having some issues. So because of that, and because of the fact she was pretty much in denial about anything going wrong or anything wrong with her, it fell to me and my siblings to step in and try to see what was going on and to help her out. That responsibility turned into a 13-year journey through Alzheimer's disease. It took 4 years to get that diagnosis of probable Alzheimer's. It took another 9 years where she progressed through the disease and declined before it finally took her life in 2009. So she has been gone now for 10 years. And I have to be honest with you, that whole experience of Alzheimer's has been the most difficult and devastating thing that I have had to deal with in my life so far. My experience with Alzheimer's is completely life-draining, obviously for the person afflicted, but also for everyone involved who knows that person and is trying to help care for that person and see them through this diagnosis. So you've probably heard the expression, write what you know about, and that's advice writers get to write well, write what you know about. And after 13 years dealing with Alzheimer's disease, I felt like I knew more than I ever really wanted or needed to know about Alzheimer's. And I decided, well, the disease changed me. I felt like I really learned a lot, and there was things that I wanted to talk about, things that I wanted to share. And that's why I decided I wanted to write a book. So after I made that decision, I did have some goals, some things that I was hoping to accomplish by the book, and I want to share those with you. First of all, I wanted to do it as a tribute to my mother. Her suffering was great. We pretty much had a worst case scenario with her, so I wanted to write the book in memory of her, and it is dedicated to her. Also, I wanted to raise awareness about Alzheimer's disease and how difficult it is to deal with. But also, I wanted to specifically address the full journey of Alzheimer's. I think I noticed in literature and in movies, people kind of don't talk about the end stage of Alzheimer's. If you look at Still Alice, that ends mid-stage. And I really wanted people to know what to expect in the full journey before it begins, at diagnosis, all the way through the end. So that was definitely something that I wanted to write about and show. I also wanted to address family relationships and how difficult this disease is on family relationships, and how important it is to put aside differences and come together as a family to support someone who is going through this kind of a journey. And finally, I wanted to inspire people who might be traveling a similar path and give them hope, because this is such a hopeless disease. But I wanted to give them hope that even though, yes, this journey is going to be incredibly difficult, that it might also teach you something to make your own life better moving forward. So those were the goals. I started writing in 2008. It was 6 months before my mother died. I started writing the book as a memoir. And as I was going along writing memoir, I found a problem. You might all guess what that is. Memoirs have to be truthful, right? And as I was writing just the facts, I wasn't really happy with the way the book was going. It wasn't all that interesting and engaging. And I thought, well, I don't think I'm going to get people to keep turning pages as a memoir. I'm not a celebrity. Nobody cares about me and my mother and what happened to us. So I decided to switch to fiction. I really wanted to use some of those literary conventions like plot, character development. I wanted to have cliffhangers at the end of chapters so people would be wanting to keep reading. So I switched to fiction. I did continue writing for 7 years. I wouldn't recommend anyone take that long to write a book. That was way too long. And I did complete 4 separate drafts of the story before I felt like I had done it justice and it was ready to be published. That was in 2015, and I took another year to actually get it published. And so the book was released in November of 2016. It's been out for a little over 2 years, and I'm thrilled to share that it has had great readership, continued readership, and increasing readership since it's been released. And I'm just now about almost at the 20,000 copies sold, which is fantastic, more than I ever could have anticipated, more readers than I ever could have anticipated, I should say. So I'm thrilled with that. The book was just released in audiobook format last September, so very happy to add that format along with the others that are available. The audiobook is a fantastic production with a phenomenal reader. Her name is Exie Sands. Also, to date, the book has been recognized with 6 literary awards, which I'm very happy about. It's nice to receive a nod from people in the publishing industry who know what it takes to write a good book. So, and I guess hopes moving forward for the book is that it continues to find new readers and have a life and help raise awareness for Alzheimer's disease until they can find a cure for this disease. It's definitely needed because it is so difficult. So I'll finish up with a quick synopsis of the book. It is a family saga novel, and it tells the fictional story of 4 troubled siblings who are torn apart and brought back together by their mother's Alzheimer's diagnosis and decline. While the book is fiction, the portrayal of Alzheimer's and that progression is very, very realistic and authentic. And that's because I kept a journal on my mother's progression, and I kept that really for the doctors and helping to remember what was going on when, and her treatments, those kinds of things, and used that as the timeline for the book. So all of the behaviors that are shown, that progression of Alzheimer's is very, very real. And finally, the book is a book about Alzheimer's, but it's also a book about the importance of family and the healing power of forgiveness to bring a family back together, to work in times of crisis for this kind of a diagnosis for a family member. So that's it. That wraps things up for me. And I guess I'll turn things over to the classroom to answer any of your questions. I do have the books that we can give away. And I just want to thank you all for your time and listening to my story today.
Okay, so questions for Kathleen? Okay, what she asked was, is it more likely that the caregiver role is being taken on by either the oldest or female sibling, offspring in a family?
Yeah, my experience is not the oldest sibling, but the sibling that is closest to the person with Alzheimer's. The person that was the favorite, the person that got along best, but definitely female. Definitely, I think caregiving falls to women more than men.
And the research would back you up on that one, because it is almost always the daughter, the daughter-in-law, if a
Yes.
spouse isn't available or in the picture as well.
Yeah.
Other questions? Yeah. Okay, she said, this is going to test my memory. Very inspiring story. I'm a mom. The last part I'm remembering, this is really bad. And that is, how did you develop your resilience and skills in it? Because the student themselves is a caregiver, so they have some idea of what you're going through. And what was the first question? Right. How did you balance being a caregiver and the rest of the obligations in your life?
Right. Yeah. Okay, I'm going to start with the balance question first. That was really difficult for me because I'm what you'd call that sandwich generation. I had a 4-year-old and a 1-year-old when my mother got ill. And so having young children, having a job where you have to pay the bills and you have to work, and then also having a parent that you have to take care of, it's overwhelming. I mean, honestly, I don't think anyone could take on Alzheimer's caregiving on their own, and you really need a lot of help. And you need to know when you need to ask for help, rally the troops. And that was part of my goal with the book, was to tell families, hey, listen, you might not even like each other, but you're going to need to come together to get through this, because no one person can take this on. I mean, we all have lives and other things. And as important as family is, you have children you have to look out for, you have bills you have to pay, and somehow it all has to get done. So I know I had years where I could just go from day to day. It was just, what do I have to get done today? And what do I have to do to take care of everyone that I have to take care of? As far as the question about resilience, I think that comes as part of the process of being a caregiver. And I think with Alzheimer's, I think it very clearly shows you eventually, because of how devastating it is, what's most important in your own life. And so I think it helps you prioritize and move forward with what's most important in your own life. So although it's devastating and there's no cure, and this is a terminal illness and where this is going, I think it helps you moving forward, knowing in your own life what you need to concentrate on and what's most important. Does that answer the question?
Got a nod from her. Other questions? The question was why it took 4 years to get a diagnosis for your mother. Were there particular reasons?
There was a lot of reasons. I said it was worst case scenario for my mother. She started showing symptoms, serious symptoms, at age 62. So this was coming on while she was in her 50s. So she was very young. She was a very independent and feisty person. And unfortunately, this disease manifested in her as aggression, hostility, paranoia. And so she didn't want us to help. She didn't think there was anything wrong. She was in complete denial, and she didn't go to the doctor. She would not do anything to try to figure out what was going on. She wouldn't admit there was a problem. So we struggled with that for a very long time. And that's most of the reason why it took so long to get that diagnosis.
You just defined the case with my grandmother too, so it's not that uncommon for everything that you were saying, but the difficulty, the lack of seeking or admitting that there is something wrong.
And I think some of that was us as well. She was so young. I mean, you don't want to jump to this is Alzheimer's. Nobody does, but you don't want to jump to that conclusion. And so I think you think, well, maybe she's just depressed and we'll wait a little while and watch and everything will be all right. And then things snowball and get out of control, basically.
Only having some kind of events that push you toward really needing to get the diagnosis.
Yes.
So I had a question. The question is, given the age of diagnosis, was a lot of your caregiving in home, or was it also split between institutionalized and at home?
That whole 9 years was in a nursing home, and the 4 years getting the diagnosis, she was at home on her own. It grew increasingly clear that she should not be on her own, and we had a lot of problems with that. But I mean, it was checking on her in her own home for 4 years. And then after the diagnosis, it was actually, she was already past mid-stage and she was a danger to herself and her home. And because none of us could actually take on the responsibility of watching her 24 hours a day, she had to be placed in a memory care facility.
Okay, I had some other, I know I saw some there. We'll go on the end here. So asking about family history, did you have other family members, other relatives that had Alzheimer's as well?
No. We didn't know, you know, back in the day, they didn't really diagnose things as Alzheimer's. It was senility or whatever. Her mother had died of a heart attack and her father lived to be very old. So no, we didn't know anything about any kind of history of it.
Okay. I've mentioned to the class that I have at least 3 generations that I can trace it back in my own, on my mother's side. Yeah. So that's something we've talked about a bit. Now, there was another hand somewhere. I don't know if you could hear that, but sometimes Alzheimer's is, they use the language of the long goodbye and the Alzheimer's Society. And the question was, you know, I guess, how much do you agree with that language or that terminology? Was that your experience? And then after the patient has passed away, is there a recovery was the second part? Or how do you feel about it after that long goodbye?
Absolutely. It is an extremely long grieving process. I mean, from the moment you get that diagnosis, this is a terminal illness and there is no cure, there is no treatment, there's nothing that's going to stop it. So from the moment you have that diagnosis, you're grieving and you're saying goodbye. And just the way the disease progresses, you're losing something of that person every day. So yes, I agree with that completely. And as far as the recovery process, well, I'm not sure how to address that except to say when it's finally over, there is a great sense of relief because it's just so horrible at the end that you want them to pass. You want it to be over. So I don't know that grieving afterwards is the same as if you lost a loved one to another disease. It's a little bit different and it's hard because you've been grieving for 13 years or whatever. And for me, it was just a great relief when it was over.
Okay. I saw, yeah. Okay, given the tearing the family apart and the difficulties that you had while you were dealing with this, what mechanisms did you use to come back together? And I guess while you're dealing with it, but also after? Yeah.
To come back together as a family or
among the family members.
As a family. Yeah, I think the coming together of family, one of the tragic things about Alzheimer's is how long it takes, but also one of the great things about it is you have a lot of time to come to terms with things and, you know, come together. And I think as things get more devastating, as your loved one is losing more things along the way, I think it's easier when you see that pain and that suffering to come together and to realize that some things just really aren't all that important. Resentments, grudges, there's a lot of silly things in life that you just need to get past and move on when you're talking about such serious things as life and death matters. So, there's a lot of time. There's a lot of time to come to terms with things and to forgive and forget and to, come together for the better good of the family.
Okay. Yes. So the question was, did you perceive any kind of difference in the way the community or others around you dealt with you, interacted with you once the diagnosis was given? And I think what this is tying to is we frequently hear about stigma with Alzheimer's. So did you perceive any of that?
Absolutely. I think people mostly just don't want to talk about it. I think people are afraid. And so therefore, if people just don't talk about, no one would say to me, well, how's your mother doing? Could I go say hello and check on her? I haven't seen her in a while. I think it's easier for people to just push it away, which is why it's so alienating to be a caregiver, because people don't know what to say. They don't know what they can do to help. They're afraid, and they don't know how to interact with those people. And so it's easier to just kind of not talk about it.
Which is interesting too, because you were saying about people dying of other diagnoses. We frequently see that same issue where, if somebody's diagnosed with cancer, oftentimes people aren't quite certain how to deal with it. Sometimes they're left alone to kind of get through it.
Right.
And then the concern is oftentimes afterwards, and when the family member has died, are they going to be left alone? Are people going to come back and rally around, or is that support gone?
Right.
So other questions? So we have somebody whose mother has been dealing with this, and the question is, people will sometimes question or ask whether the mother is forgetting you, asking sometimes, I guess what we could say are sensitive questions, things that may put you in an awkward spot or difficult to deal with. So did that happen with you?
Absolutely.
How did you deal with that?
Yeah. First of all, let me say I'm sorry to this person. I mean, that they have to deal with this. It's really awful. It's not something I would want anyone to have to deal with. But yes, I got things like, why do you go visit your mother if she doesn't remember you? And the way I always answered those questions, first they kind of ticked me off, but you try to be polite and you answer and you say, she doesn't remember me, but I remember her, and that's why I go visit her.
Mm-hmm.
I mean, there's not much more that you can do except to try to convey, I love this person and I'm going to keep seeing this person, even though because of this disease, they don't remember me anymore.
Right.
So that's kind of the way I handled it. Was there a question than that? Did I answer that question completely?
I think so, yeah. Other questions? I'm willing to keep this going as long as this is funny for me.
Questions. Thank you, everyone. This is wonderful.
Well, my laptop usually doesn't talk back to me. They just sit there and look at me and I talk to them. So this is kind of fun. Okay, so even despite the forgetting and memory loss and not maybe recognizing you, did you still see your mom? And again, I think it's linked to that question. It's still that person.
Absolutely. There's little glimpses, and it's funny with Alzheimer's how there are some days that there's nothing there, and then some days there's just this moments of clarity where she would say things and it's like, oh, where did that come from? How does she remember that? And it comes and goes. It's so odd the way that is, how they can have a really good day and a really bad day, and you never know which one's coming when. I would say there was those moments of clarity all the way through mid-stage. Probably until end stage, there were flashes that you can see of the person that you used to know, and it just kind of comes and goes. So you never know when you're going to get it, but when you do get it, it's pretty great.
Okay. Other questions? Okay. The question was, did you attend any kind of caregiver support group or be a part of a support group either during this, after? Did you feel that it was beneficial?
Yeah, no, I did not. When we were going through this, there wasn't really that much available. This was 1996 to 2009. So not a whole lot out there. There was an Alzheimer's Association, but not really caregiving support groups, at least not in my area. So, I mean, that can be very alienating. And I would say now, looking back, I wish I would have had that opportunity for a support group. There are some great support groups now that you can be a part of, and you don't even have to go anywhere. I mean, sometimes with caregivers, the problem is you don't have time because you're so overwhelmed to go to a meeting, to go to a support group, but you can do it online. And there's a great group on Facebook called Memory People. It's a closed group. You can ask to join it. And there is so much support and information that you can get there just from reading posts, reading things that are going on with other people, or you can ask questions. And there's so many people in that group from all over the United States. I know probably Canada as well, that usually you can find people to give you recommendations, doctors, facilities, memory care units, dealing with specific kinds of issues coming up. You could post a message there and people will immediately respond and come to your aid and tell you their experience and what might work, what might not work. There's a lot of talk there about medicine. We're giving this or that and it's not working. Does anyone have any advice? But there's just so many places you can reach out now online where you don't have to actually even be in a group or have a set time where you're supposed to be someplace. So a lot more opportunity now, which is wonderful, to get help and get support from people that are going through the exact same thing you are.
Okay, we probably have time for one or two more. If people have questions. Yes. The question is, were there a lot of arguments among the siblings as to what the right next step was?
Yes, absolutely. And not always agreement on what is the right thing to do. And obviously that goes back to people having different relationships with the person that is ill and different ways that they remember growing up, or different resentments, grudges with the family. I mean, it's the reason that I wrote the book. And yeah, we were split. We had a lot of fights. We had a lot of fights, and it wasn't anything like what I have depicted in the book. But yeah, it's really tough when you and your siblings aren't really that close, and you don't agree on things, and you don't all have the same relationship with the parent. There's a lot of broken families now, or remarried. And I mean, you've got so many different people, personalities, and relationships that it's just it's very difficult.
Okay, any last questions? Yes. Okay, so the question was, what is something in society that should and needs to change with regard to the perception of people with Alzheimer's and dementia?
Yeah. I think something that I learned through this experience is to be much more compassionate and kind to those who appear to be confused or not understand what's going on. I think in our society that people are a little impatient, abrupt, and are not kind with people that you find in a public setting that really are having problems understanding what's going on, or having problems functioning, really. And I think I go out of my way now to be kind to anyone that I see that I feel like they're confused or they don't know what's going on. I mean, honestly, you do not know what's going on with anyone. And I think we can all be kinder, and I think we all need to be supportive. This disease is predicted to be an epidemic. So there's going to be more and more people living with Alzheimer's for very long periods of time. And, you don't want them to be shut in. These are people that are going to be out in public, in restaurants, not knowing how to order off a menu, shopping, and not understanding how to pay with people in the line behind them who are ticked off because they can't get out with their coffee in 1 minute. I think we can all be a lot kinder and understand there's going to be a lot of people out there who can't function normally the way that we do.
So a lot of it comes down to being a bit empathic and actually putting yourself in other shoes, or trying to understand what's really going on in the circumstances rather than jumping to conclusions, which we're all going to do, right?
Yes, absolutely.
Okay, I've got one more, and then we're going to Okay, the question was your mother able to remember how to do certain things, like maybe she enjoyed playing an instrument or had a particular hobby or something, but then kind of held on to those skills or not?
Well, let me think. As the disease was progressing, she was always very healthy and she rode her bike. So she continued to exercise and ride her bike up until we put her in a nursing home. I mean, she was in really good shape physically. She did continue to do that. She did lose the ability to cook. She'd always been a really good cook, and she couldn't cook anymore. And this was probably a year or two before the diagnosis. So she just started going out and going through the drive-through, and she'd get a sandwich from the drive-through and take it home every day, or she would just eat fruit. She stopped cooking, but you know, it's amazing how they can compensate for the things that they lose by doing something else. Those are the first things that come to mind. Really, I can't think of anything else right offhand.
Okay. Well, I want to thank you for giving up your afternoon, or at least a chunk of your afternoon here with us. I'm glad technology was our friend.
Me too, it worked.
And I will look forward to, you can send me the codes. We will do a draw based on that and let you know how that goes. And
Okay, why don't you draw two?
Okay.
Draw for two, and I'll give you 2 codes to download the audiobook.
Okay. And I had mentioned that to them, so I'll do that and I'll let you know that we've done that. And we appreciate your time and sharing all the information.
Thank you. Thank you, everyone. Those were great questions.
Okay. Thank you very much.